Well, hello everybody. This is a really exciting segment because we have a guest, Dr. Paul Queen.
Hello.
And he is a chiropractor up in the McKinney area. And the reason we wanted to do this together is because we actually share a number of clients. And we had both discussed there's really an art and an importance to collaboration. And a funny story, he came into the waiting room today and saw one of our mutual friends, and he was actually able to talk to his OT today, and there's been some differences and some concerns, and they were able to kind of collaborate on that and realize that they were both on the same page. And it opens up the doorway to so many things, especially when we're dealing with our spectrum clients. They're seeing multiple providers. I always talk about that hub and spoke concept, and when they're doing that, it's kind of like having spokes but no connection to a wheel if there's no collaboration. If there's collaboration, maybe where I'm doing something, I can lean on another provider to help me out with that to make cohesiveness. So we love having Dr. Queen here. He's able to treat many of our clients at very many functional levels.
Yep.
So why don't you share a little bit about what you do?
Well, I'm down in McKinney, and I have Straight Up Chiropractic, and I see these kids come in and they struggle with so many of these sensory issues, and Kate sees so many of the same clients we do. And when I work with these kids, there's so much more that needs to happen with these kids that I don't do. I get their nervous system calmed down where they can function, but they have so much catching up to do. And that's where they come in, and they're really good at making sure the kid gets the physical activity they need, the movement and the stimulation to that brain and that prefrontal cortex that is so important to these kids. And, we were talking about this kid today, and, we see when we can work together, when they have a lapse in care sometimes, we see the same issues in both deals, and we can talk. And so I was able to work with the therapist, and it was important. She's like, I understand, I get it now. Mm-hmm. And it's that important with these kids.
And I love that Dr. Queen is able to kind of jump that development, and then we're able to go back and fill it in. I would say we're like the backfillers. So he's able to do his treatment and jump, and it allows us to be able to get in, because when our kids have an excited or resistant nervous system, we fight so much harder. It's almost like not being able to get your garage door up to get your car out. You can pull it up, or you can hit the button, it raises. When Dr. Queen sees them, he's able to get that button going so the garage door goes up and we can get the car out. That's just a simple way of explaining neurology, which is very complex, but it's actually quite simple. So I really love that piece we're able to do.
Absolutely.
And why don't you tell everybody where you are in McKinney, because McKinney's gotten really big.
It has. This whole area is growing. I'm on Virginia Parkway, right down the middle of the heart of McKinney. It's, maybe 30 minutes from here.
Oh, maybe not even that. Traffic-wise, maybe 15.
Yeah.
During the day, it's very close. And we have a number of kiddos that we work with, and all of us really, Dr. Queen reached out to me to be able to network and collaborate. He's one of those unique individuals that's like, I know I'm a piece of the puzzle, I'm not everything, and I want to be able to work with other providers to bring that quality of excellence together for the families and to be able to help our families.
Because I get kids come in, or parents come in my workshops and like, what do we do from here? I'm like, you need more help. Mm-hmm. I'm not your answer for that.
There's never one fix-it man, is it?
No,
so,
it's a storm of things coming together.
And everything we're doing will affect overall function, behavior, emotional regulation, and attention and focus.
Yeah.
So just realize there are teams out there. Us at Cutting Edge, we work with many providers. We refer out when we need to. So if you're a therapist, if you come in for an evaluation and we say we think you need to see another provider, we have a list of providers that we work together with and feel very comfortable referring to.
One thing I saw in your all's clinic here that I have never seen before is a activity of daily living. Because a lot of these kids, once they get older, they need that because they don't know how to go out and do their stuff once they get older. And I think that is so important with these kids.
Neurology, does the brain ever not change?
It's plastic. It moves and
it
it's
moves
dynamic
and changes
all the time.
That's why there's nothing magic about 18, 21,
Right.
30, whatever. So that's why, and same thing with Dr. Queen, he's able to treat any age. He sees all the way up into older adults. So there's really no limit. We're trained to treat the entire person, whether they're 2 months old or whether they're 72 years old.
But the thing is with these kids, the earlier we get them,
the better they do.
Because the brain functions better and differently, and it heals differently at that age.
Definitely. So make sure you reach out if you have any questions about Dr. Queen. I have his referral resources, and we can send you over there. And
I've got Kate's.
Yeah, absolutely.
Yep.
And we just love to work together, so we wanted to do this quick segment for you.